So the delta fibres, larger fibres, whereas the C fibres are smaller in terms of diameter. There are many C fibres which conduct slower because it's a narrower fibre. The A delta fibres are fast, and the function of the A delta fibres is this is a withdrawal response. So it's the first sharp pain that one gets, and then the C fibres give you the second pain. So if someone pinches your arm or something like that, you feel that first pinch, and then you feel this throbbing pain afterwards, and that's the slower C fibres causing that second type of pain. So the dorsal horn is a very complicated area, but very important in terms of pain transmission. Most efferent fibres enter the spinal cord via the dorsal root, and the dorsal horn is made up of different lamellae. Lamina 2 is known as the substantia gelatinosa, and the main input into the substantia gelatinosa comes from C fibres, where they synapse with smaller nerves called interneurones. The second order neurons are larger in lamella 1. These are called nociceptor specific neurons, and lamella 5, which are the wide dynamic range neurons. And these are involved in pain localization, and the deeper ones are involved in coding pain intensity. So there's a multitude of neurotransmitters, but just a few of them include substance P, which is synthesized in about 20% of C fibers, and it acts on specific receptors to excite interneurons and other second order neurons. The NMDA receptor agonists require glutamates, so these are amino acids, glutamate or aspartate, and glycine to an adjacent site. And ketamine is one of a number of drugs which non-competitive NMDA antagonists, and can be useful in terms of treating pain, particularly the wind-up pain, where a repetitive stimulus leads to a dramatic increase in the activity of the dorsal horn. So if you have a nociceptor pain and then transmission up the pathways to the dorsal horn, and that's an ongoing problem, then there's a significant increase in terms of the amount of pain that the patient can feel. Peripheral sensitization, tissue injury can stimulate synthesis of prostaglandins and bradykinins and neuropeptides such as substance P from the C fibers. And this so-called inflammatory soup can also contain other transmitters as well, such as histamine, serotonin, and various ions. And this results in the inflammatory process. And in this situation, an innocuous stimulus can actually evoke pain, and this is termed hyperalgesia. So a stimulus that normally wouldn't hurt at all becomes painful. And I guess a good example of that might be severe sunburn. We have endogenous opioid peptides such as endorphins and enkephalins. Endorphins have a high specificity for the mu receptor, and the mu receptor was of course named after morphine. Dynorphins for kappa receptors, and enkephalins for delta receptors. And these opioid receptors are concentrated in certain areas, including the dorsal horn and in the brain, particularly in the periaqueductal grey area, and in the brain stem also the midline raphe nuclei. So other transmitters, particularly looking at the descending inhibitory pathways, serotonin's important. Noradrenaline is a neurotransmitter for the descending inhibitory spinal pathway running from the lateral reticular formation of the midbrain caudally, and both neurotransmitters are known to be important in modulating pain in isolation and also enhancing morphine and modifying tolerance. And one thinks about using drugs such as the tricyclic antidepressants in that situation. Of course, those drugs are widely used in treating both cancer and non-cancer pain.